Well, it's supposed to help millions of Ontarians access free pharmacare. The new OHIP Plus program is offering free prescription drugs to anyone under the age of 25. And while it's great news for many in this province, for some, it's having some unintended consequences, those who are already privately covered. One pharmacist tells us that he's seeing some delays for his patients because the government only covers some drugs, and so they're left sorting out who's paying.
A lot of insurances is now saying bill the government first, and they're refusing the drug claims. So now we have to show them that proof that the government doesn't cover this drug in order for them to cover it. So it's adding extra time and energy in order for someone to access a treatment they were just on last month.
Dr. Michael Fanous says the other issue is that some patients who were successfully using a specific drug or brand may now have to switch to a different brand, usually a generic one or another drug altogether if theirs isn't covered under OHIP Plus. That could potentially set them back health-wise if they don't react well to the alternate medication. He says patients can request coverage for the drug they've been taking that they know works, but that can take time.
They'll have to satisfy some government criteria that shows that they can't tolerate the generic brand.
So they would have to go and take it first?
Yeah, they would have to take it first to satisfy that requirement, and then the doctor would have to write into the Ministry of Health saying that they can't tolerate this brand in order for them to access the brand name medication, and the whole process can take months. The wider issue is that insurance plans have historically been dictating to healthcare professionals what we can and cannot use to treat someone's illness. Sometimes it's disappointing that after all that work and time that was invested in the patient, I can't provide the medication that I think is best for them because the insurance wants to give something that's cheaper or they don't cover the medication.
And we reached out to the Ministry of Health, who in a statement tells us Ontario has an established process for determining which drug products are funded under the ministry's public drug programs. The statement goes on to say the government is working with representatives from the private insurance industry to ensure that individuals currently covered through private insurance, including individuals who may be taking a drug eligible for funding through the Exceptional Access Program, smoothly transition to coverage through OHIP Plus. OHIP Plus extends its coverage to 4 million young Ontarians and includes 4,400 drugs, most of them generic brands. Janelle Amasa, City News.